Good morning, good morning, good morning. This is Dr. Yonnette coming to you with another episode of Baby Talk. How are you doing today? It's Friday. It's Friday. Yay, the weekend, time to relax and have some more me time as the work week is ending. So, today I want to talk with you about sensory processing. How do we process the senses? Through the senses that we have: hearing, seeing, taste, sound, touch. I said hearing already. Touch. How do we process those things, where we are in terms of balance? And how would your child process these sensory stimuli that come into their system? For a lot of children with autism spectrum disorder, end up having sensory processing disorder or difficulties. And I want to share with you a little more so that you get some understanding of what you are seeing if your child is demonstrating a sensory processing disorder. Now, children with this disorder have problems processing information from their senses, and it makes them hard to respond to the information right away. So, what are the senses that I'm referring to? I'm referring to the sense of touch, movement, smell, taste, vision, and hearing. So, take a moment and think about what you have been journaling in terms of your child. Think about whether you are seeing any of these difficulties demonstrating in your child. Is your child having difficulties with sound? They're always covering their ears, or is he resistant to certain textures and certain taste? Is your child, always wanting to be in the dark? Doesn't want to move a lot, doesn't want people to touch them, his or her clothes irritate them. What are you seeing in your child? A lot of children, though, with autism spectrum disorder, attention deficit hyperactivity disorder, and other developmental disabilities experience sensory processing disorder. And so let's talk a little more in details. I'm sharing today from Peace Health. And so I want you to listen up as we talk a little more in details. What actually causes a child to have a sensory processing disorder? As I've been saying, in all my discourse, the cause is really unknown, but most often it is seen in children with autism spectrum disorder and the other developmental disorders that I mentioned previously. So let's look for the symptoms. Let's look at the symptoms that you will see that will be a trigger for you that perhaps my child is experiencing sensory processing disorder, and I should pursue assistance from my occupational therapist, that would be me, or your pediatrician, so that you can get the help you need for your child. Okay, here are the symptoms that you need to be aware of. Either your child is in constant movement, he's always moving, or he gets fatigued very easily from going back and forth and he goes back and forth between the two. He's always on the move. He cannot sit down. He's like a motor mouse, or a motor, he's always going. He has a motor mouth, or he has this body that's always on the move. And then he gets tired, he plops down, and then he's back again on the move. Are you seeing that with your child? What about if your child is oversensitive to touch? You touch him and he wants to wipe it off and just get rid of that touch. He's oversensitive to touch of his clothing. He's oversensitive to touch on the things on the floor. That's another symptom that might be a trigger for you to be aware of what's going on with your child. Your child may be refusing to eat certain foods. The child may be what we call a picky eater. So you can barely get him to eat a few things. And if you add any little taste, any variation in the taste, their child refuses that food. You know, are you seeing that in your child? Is your child oversensitive to odors? That's very similar to taste. You know, if you change the smell around him, he or she just totally goes off, and it's difficult to bring him back or bring her back to themselves. Are you seeing your child being hypersensitive to fabrics? I talked about that before, clothing. Tags really, really bother them, and you have to be cutting the clothing tags off. Or if you give your child certain materials, then the child, or clothing made from certain material or fabric, the child is itchy and he or she is unable to maintain composure because of the clothing he is wearing or she is wearing. Now, you may also see demonstrated the symptom of your child getting very, very out of control and disgusted when his hands get dirty. For example, you might be doing a little craft with your child, or you may be spreading peanut butter on the bread for your child, or he or she might be engaging in that activity, and some dirt or some of the material gets on the hand and he has to clean it off right away. It's really aversive to him. So let's keep going. Your child might become uncomfortable, very uncomfortable with some movements. Like you may put him in a swing and he's grasping and grabbing to hold on to you. He's going down a slide and he's having problems doing that. Or, you know, your child may have trouble learning how to climb up and down stairs or getting on the elevator. Are you seeing difficulty in your child when it comes to being able to calm him or herself down after an exercise or after he becomes upset? You know, it's that case where the child gets so upset that he can't pull himself back, and it takes you a while. You really just have to leave the child to get out of that rut of being out of control. Do you see your child? And again, we are talking about the symptoms of sensory processing disorder right now. So are you seeing in your child that your child loves to jump or swing or spin excessively? You know, that spinning movement, he's going round and around, or he wants to swing and he's swinging so hard or jumping so hard, he's always jumping up and down excessively. Are you seeing that in your child? Does your child appear to be clumsy, always tripping over, having poor balance? And does he or she have an odd posture? What about the posture? Is it different from what you normally see? Does your child have difficulties handling small objects such as buttons and snaps? And is your child overly sensitive to sound? The vacuum cleaner bothers him, the lawnmower bothers him, the hair dryer, an airplane flying overhead, the sirens, they're also upsetting to him that he loses control and he's crying, and you have to stop and really attend to help him to calm. And then finally, does your child lack creativity in play? You know, does he lack variety? Is he like just fixated on doing one activity over and over and over again, and it must be done in the same way? Otherwise, again, he or she loses composure, and you have to really sit with him to bring him back to where he should be. Now, how do you get a diagnosis of a sensory processing disorder? Your child may see your pediatrician, talk with your pediatrician, and then your pediatrician will refer you to the occupational therapist who will do a complete assessment of where your child is, looking at your child's coordination, your child's eye movements, his response to stimulation in his or her environment. And then the treatment that is normally administered to your child is dependent on the type of sensory processing disorder your child is demonstrated. Usually, the occupational therapist will be engaged in that treatment. If you're having some balance and movement issues, we will call in the physical therapist who will also work with your child to provide the treatment you need. Now, I want you to be aware that every Friday, I am going to spend some time talking about sensory processing disorders. And I'm going to give you some examples of sensory processing disorders. And then I am going to go through some of the strategies that you can use with your child who is experiencing this particular disorder. It is always